that can withstand like 10, 15 feet of storm surge. And so they do that so that they can keep the patients there, because if you don't have that and you're in a low-lying area, you got to do the evacuations. A number of the hospital systems have done that, who are in those low-lying areas. I think particularly in the Tampa area, I know we had a lot of special needs evacuations, as we should have. I mean, you got to take the information that you have, and they're going to feel effects from this. But my hope is that, you know, those patients are going to be able to be brought back, you know, as soon as that storm is passed. And I don't anticipate major structural damage. Would be my hope in some of those areas.
So how many individual?
I probably do. Yep.
Sorry, Marilyn. You don't have a take on evacuations for Cape Coral. Just looked on. If you look at the storm surge diagrams that NWS has, it looks like there's a lot of the storm surges in that area. Sanibel and Captiva are getting hammered right now. I'm just wondering how evacuation efforts went there as they embraced the eye.
Again, all of those individuals were under evacuation orders. We don't actually have the numbers of what the percent was that evacuated versus those that didn't. I would imagine, since most of that same area went through Charlie, they probably evacuated. Again, Charlie was a fraction of the size of this particular storm, but I would imagine that most people that have lived through that, they went ahead and evacuated.
I think another issue is just, I mean, there were people that evacuated Tampa Bay to Fort Myers because you see the different weather tracks, and it was thought that it would go hit Tampa, maybe go up the coast, and that was not that long ago. I mean, that was, 36, 48 hours ago. You go back another 12, 24 hours from that, it was going to hit Taylor County. And so I think that some of the folks in Southwest Florida, because so much focus was on Tampa, then when it says, oh, actually it may be coming here, I mean, I do think some heeded the warnings, but I think it's because the forecast can kind of be all over the map, that sometimes people say, well, you said it was there, then you said it was there. I think in the future, we tried to stress the uncertainty. When you have a model taking it to Louisiana and another model taking it to Sarasota, and then you just kind of meet, I mean, it's not probably the ideal situation. Now that we're close, once you're within 72, certainly 48, I mean, those are very accurate forecasts. But before that, I mean, there's just so much uncertainty. But I think sometimes people think, well, you said it was going to be here, and then now you're saying it's going to be here. So we'll see how it goes. I know the folks in Lee County, once that forecast changed, I know they acted very quickly, as they should have. And I know that they provided people with an ample opportunity to be able to evacuate. I do think some heeded it, some did not and chose to hunker down. And hopefully, the people that made that choice, that it works out favorably for them.
Issues are going to be specifically for the Tampa Bay area when it comes to rescue efforts from the state. What do you think the biggest issues
in the Tampa Bay area for rescue? Well, I mean, obviously we have enough assets and we understand that this is a big impact, that the rescue efforts are not going to be limited to one municipality or one county. I mean, you're going to potentially have more. My hope is that you're not going to need massive rescue efforts the further away you are from the storm. I also have a huge amount of confidence in the folks in the Tampa Bay area. You look at the sheriff's departments, these are very first-rate operations. They have excellent ability to respond to that. Kevin will be here. Our folks will be here if needed, but our sense is that the further away from the storm, probably the local responders are going to be able to handle that. Here in Southwest Florida, you're going to have all those local responders out, but then you're also going to have all this support, Coast Guard, FWC, you're going to have National Guard. I mean, this is a really, really concerted effort, and that's just the reality when you have such a significant impacted spot. So hopefully they don't need us to fleet resources up. We will do it if there is some really significant. But you look at the guys they got up there, Hillsborough, Pinellas, Pasco, Manatee. I mean, those are really, really professional operations. Did you want Shimon, you said?
I did.
Okay.
Just one follow-up question. You mentioned that there were 150 facilities with evacuated patients, and 15 of them are hospitals. How many nursing homes patients were involved in? And there's always the issue of transfer trauma in transfer of an evacuation. How many, what are you doing to kind of anticipate that trauma on those individuals?
Well, to answer your how many question first, nursing homes that have been evacuated, at least, again, most recent information I have, 40, ALFs 91. The number of nursing home residents, 3,508. Number of ALF residents, 3,012. And that's the most recent information I have as of probably 10 o'clock or so this morning. Remembering that the facilities are self-reporting into our health facility reporting system. Now, to answer your other question, the Agency for Healthcare Administration has many partners involved in the effort to move patients when they need to be moved. Not only do the facility staff have a role to play, but all of the associations that I mentioned earlier, right? So the Hospital Association, Healthcare Association, Leading Age, all of those individuals are directly, they directly work with their member facilities, so nursing homes and ALFs. So it's a coordinated effort to make sure that the individuals can be placed in the right location for them, keeping in mind their health needs. Our health facility reporting system is also used to find where there are vacancies in other facilities. Many of these nursing homes in particular, have sister facilities elsewhere in the state. So it makes that kind of transfer a lot easier and less stressful on the individuals who have to change their environment.
So we'll have another update in another few hours. I would just say it seems like over the last 12 to 24 hours, every time you look at this storm, it's just been bad news. It gets stronger, it gets larger, and we really appreciate people's concern for Florida. We do appreciate the prayers. I'm going to be saying prayers that the folks there are able to get through this as best as humanly possible. This is a really, really significant storm. It will be one of the storms people always remember when they think about Southwest Florida. Probably be the big one that they always remember. And if you know anything about our state, you go to Panama City, that Michael is just part of the DNA of the community. Homestead, Hurricane Andrew is just part of the DNA of the community. This Ian is going to rank up there with that. So we need the thoughts and prayers over the near term, and then there's going to be a huge effort on the back end to help people and to get the communities back on their feet. Thank you.